A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow. LIFT, LIFTT, as we often style ourselves. LIFT is what is known as a Center for Independent Living, meaning we provide services and programming to people with disabilities across a 18 county service area of eastern and south central Montana with the goal of empowering the people with disabilities to break down the physical, bureaucratic, and cultural barriers that prevent them from being fully independent participants in their lives and communities. For more information about LIFT, we encourage you to visit our website, lift.org, or give one of our offices a call. We have offices in Billings and in Glendive. Our Billings office can be reached at 406-259-5181, and our Glendive office can be reached at 406-948-8500. Today on the show, we'll be discussing a topic that is coming to the forefront of disability advocacy in Montana. There is currently a legislative interim committee that is studying this issue, and that topic is guardianship and specifically alternatives to guardianship. I'll let our guest explain more about what those words mean, but guardianship is where, in this sense, is where we are talking about someone assuming responsibility for the day-to-day life of another adult. We're not talking about child custody. That's a whole nother area of but we are talking about adult guardianship in this case. Our guest today is Theresa Baldry. Theresa is a project coordinator with the Rural Institute for Inclusive Communities. Now, the Rural Institute is based at the University of Montana in Missoula, but Theresa, you yourself are based in Miles City, correct?
Correct, right here in Eastern Montana.
Right here in Eastern Montana. And the project that Theresa works on is, amongst others, is the Transition and Employment Project that's being conducted by the Rural Institute. And one of the facets of that project is alternatives to guardianship. Welcome, Theresa.
Thank you, Jed. Appreciate your inviting us here today.
Thanks. Again, as I sort of alluded to in the introduction, this is a complicated topic. I think it's best we sort of start at the beginning. What exactly is guardianship in the sense that we're talking about it today?
Thanks, Jed. And you started with my very first bullet. I wanted to clarify that we're talking about adult guardianship, not that of a minor or a child. So thanks for starting us on that right track. The other piece I want to clarify for your audience is that guardianship is state specific. So what applies to each state is what exists in each state. That doesn't cross boundaries, and people need to be aware of that, where less restrictive alternatives can often be used in another state. And with a very mobile population, that can be relevant, especially when you're seeking medical care. So guardianship is a legal process initiated by one person that removes the rights of another person around decision-making. And that's where I like to throw in, I'm not an attorney. I've been doing this work since 2007, but I come at it as a parent of a person with a disability who guardianship was being recommended to and for, and he did not want it and we did not want it. So we needed options and began to explore what was available in Montana. Guardianship uses attorneys and the state district court system for a judge to determine who will be the decision maker. In that legal determination, the person being placed under guardianship is considered to be incompetent or incapacitated. And that means that they're viewed as being unable to make decisions to ensure their personal safety. These could be decisions about healthcare, living arrangements, or finances. Just like guardianship's a legal process, undoing a guardianship is also a legal process. And interestingly, it's called a restoration of rights. So in Montana, when you look at the purpose of a guardianship, it is to only be used as necessary to promote and protect the well-being of a person. The guardianship must be designed to encourage the development of maximum self-reliance and independence in the person, and may be ordered only to the extent that the person's actual mental or physical limitations require it. So in Montana, we started with this belief that guardianship would be the last resort. In practicality, it often is not. Just like you mentioned, the interim committee recently, a report, in fact, at the November meeting, a report was provided to the committee that on an annual basis since 2023, 1,200 people are placed under guardianship in the state of Montana.
Okay. And that does seem like a lot out of a population of maybe 1.1, 1.2 million. I can't do that much math in my head, but that does seem like, like it's fully 1% of the population if we're 1.2 million or.
And when a person is, and that's annually each year. So when these individuals are placed under the guardianship, that remains in place for their lifetime.
Right.
So it's just that many people each year are being added to this pool of people who've been placed under guardianship in the state of Montana.
Right. And so let's talk a little bit about, again, it's meant to be a sort of a last resort. Why is it all of a sudden being used so much and perhaps, again, and this is a judgment call, perhaps being overused or misused, in your opinion? Again, you said your experience, and full disclosure, I know your family a little from over the years of working in this field. And again, I'm just curious why guardianship was recommended in using your case as an example, and we can talk about how that didn't work for you and your family, maybe.
So I'll start with my family, and for the individual that was considered needing guardianship, which is my son. And because of him being a person with a disability, it's physically right in front of you when you meet him, and he has communication difficulties. So it takes him more time and often the use of assistive technology to communicate with other people. So as he was becoming an adult, people just naturally thought that's what needed to happen, that because he's a person with a disability and this is a struggle for him, the tool that we would choose to use, which seems like a hammer, was that we would put him under a guardianship. My son had already been involved in a couple civil rights cases where he felt his rights were violated and had to advocate for himself. So having gone through that process, he didn't want to have his rights that he'd been working on building taken from him. So we needed other tools that still provided him support around decision-making and communicating his choices, but didn't remove his rights. You mentioned.
Right, and I think you make a sort of
expand out from your son, I think you make a very interesting point there, that it was assumed, and it's, and when we say that, who's doing the assuming, I guess, is.
In our experience, it was both recommended from the medical community and the educational community as he was transitioning from a youth to becoming an adult. So we were hearing it from multiple people that we relied on.
Right.
But that to me goes back to why guardianship gets used. And historically, it's been the practice we use to support people who may need assistance with decision making. It comes from a belief, I think, that people need to be protected, and that in creating a guardianship, we're protecting the person. But what we don't consider is that flip side, that this will remove the rights of that person and the long-term impact to the person when their rights are removed. I also think the reason we end up with guardianship so much is there's a lack of information around these less restrictive alternatives in Montana. It wasn't until 2020 when we started looking at how do we legislatively address this, and then in October 1st of 2021, an act requiring consideration of less restrictive alternatives in guardianship proceedings went into place. So that's not that long ago. And it changed a few things. It added in a definition for less restrictive alternatives and a definition for supported decision making. But one of the biggest changes it made was an expectation that whenever the court was being petitioned for a guardianship, that part of that petition would contain what were the less restrictive alternatives that were considered in trying to meet the needs of the person. And that not just that they were considered, but what did we try? What did we use? Is this really the last resort? Have other pieces, less restrictive alternatives, been used to support this person?
Okay. So let's talk a little bit about those alternatives. Because again, they're are those alternatives well defined as programs and laws as guardianship is? Is that one of the drawbacks?
I would agree with you, Jed. That is one of the drawbacks. It's a strength and a drawback in that it's defined that they're to be considered, but the depth and breadth of what's available under less restrictive alternatives is quite significant. When we look at it, it can be both formal and informal supports. So it may be that in getting to know the person, we start to better understand how is it that they need to be supported? What does that look like for each person? Because it's going to vary. There's so many other pieces that come into this as well. So in different areas of life, they may need more assistance than in others. It may be that financially, someone doesn't need much support. They're able to do that component. Or it might be that their money management skills have not developed yet. And so they're going to need some help learning how to manage money, as well as practice manage money. And then their level of support can be decreased. So there's a variety of areas of life that we have to consider how someone would be supported. And the only way we really find that out is to get to know the person better.
Okay. Right. And again, that's kind of what we do. It's kind of the approach we take as an independent living center when someone comes in our door seeking services. We try do our best to get to know them and do our best to tailor those services to what their goals and their expectations are. Obviously, when we're helping people with some things, it's a little more cut and dry than others, but You know, we try to make it as personalized and as, and again, it is quite astonishing what the curtailment of rights involved in invoking a guardianship is, and the fact that then you have to go to a court to get it undone if you and others so choose. And
to me,
you
if
know,
you don't
again,
mind, Jed, you're touching on one of the beauties of the less restrictive alternatives. So when we're using less restrictive alternatives and we're getting to know the person and the people around them, that's who then starts to develop the less restrictive alternatives. They start to say, here's the tools that would meet the needs of this person in this area. And here's the tool that would meet the needs of the person in this area. And as their skills are acquired, those tools can be adjusted, and we never have to involve the courts or attorneys to move forward in supporting the person. And they're always a key component in it, where within guardianship, they don't have to be. Best practice is that they are involved and included, but they don't have to be. And I think those are some significant changes between the two.
okay, so yeah, do you have a so do you have an example of some alternatives that are being used in Montana?
Absolutely. So when we talk about informal supports, it might be someone that's helping someone. A lot of times we're talking about what does someone need around making a decision. So I kind of look at it as an ABC. A, do they need access to the information? B, do they need help understanding and evaluating the information they're getting? Can they look at what all the choices are? Do they have the experiences to expand what potential choices might be available? And then C, communicating their choice. So those informal supports might be someone helping you access online medical. You've not had a lot of experience with getting into a medical online system. You thought everything was just something you communicated with your doctor. And now most of the time you've got to be able to access the online portal, and you've got to be able to get to the right spot to even book an appointment or to get the information you want to receive from your doctor or send to your doctor. So it might be just someone helping you learn that process. It might be someone helping you learn how to communicate the information that you want to share. Sometimes people don't get to talk to people very often, and so they get on the phone and they start having a conversational, and it takes them away from what they needed to communicate, and they fail to give the information or request the information that they really needed. So there's always these learning opportunities that come up, and those I kind of consider those informal supports. More formal supports can start to look for, at a really low level, a supported decision-making plan. So what does that look like? Who are the people that are going to be a part of your team that you go to when you need help in decisions around different areas? You're picking Joe because Joe is someone who knows a lot about vehicles that you know. He's the one who's helped you when you've needed, who you've called when you needed help with your vehicle. And so he knows a lot about it. He's the person that's going to help you with that. Around your medical decisions, because you want to consider your cultural views, maybe you're picking a family member who aligns with your cultural views that's going to help you in navigating the medical system. You can have different supporters in different roles on that plan. A supported decision-making plan currently in Montana can be informal, so it's just a communication piece, but that can be harder for the person needing support as well. So if we write it out, we take the time to map it out with them, then they can also use that tool to help them understand who they go to when they're needing assistance in this area. When we move up in a more formal support, so less autonomy of the person, we can look at powers of attorney. So a power of attorney could be created for medical decision-making or for financial decision-making, and there's sample forms on the Department of Public Health and Human Services website. I often share those forms because they were created specifically for Montanans. In that, the person is choosing who they want to make decisions for them. So they're still an active participant in the process, but they're saying, this is the person I'm choosing for myself to represent me, to make the decisions for me. That I believe they align with my beliefs and my values and are going to move forward what I wish. We can look at a representative payee to work with Social Security, and even a limited guardianship can be considered a less restrictive alternative if we look at it as it's limited to one area of life. So maybe they don't need help with anything but the medical. They don't need help with the financial. So the guardianship is limited to one area of life, medical, and it's limited to the amount of time it exists. So maybe it's only for 1 year. And we're going to work on building some skills, and we're going to reevaluate whether or not this guardianship is still needed.
What are you going to do? Well, this has been a fascinating chance to learn more about this process and what it looks like here in Montana. We've got just a couple minutes left already, so we'll definitely talk about having you back on another show sometime. But does the Alternatives to Guardianship and the Transition Employment Project have information on a website somewhere or something you'd like to plug?
Yes, please. If you go to the Rural Institute and then to Transition and Employment Projects, we have a whole tab for Alternatives to Guardianship. And we've been spreading the information because that's one of the barriers. It's not out there. So you can contact vocational rehabilitation, the independent living centers, the Montana Empowerment Center, our parent training and information center, the developmental disability programs has been learning about less restrictive alternatives, disability rights, adult protective services. Lots of groups are looking at how do we make sure this information is available, but we're always available as one of those places to stop.
All right. Theresa Baldry with the Rural Institute for Inclusive Communities at the University of Montana. Thank you for joining us today. And we'll definitely try and have you back in the new year. This has been Living Well in Montana, a program of living independently for today and tomorrow. For more information about LIFTT, LIFTT, visit us online at liftt.org or give us a call in Billings at 406-259-5181 or in Glendive at 406-948-8500. My name is Jed Barton. Thank you and good day.